Everybody, hello. I'm Charles Shapiro. I'm the President of World Affairs Council. I want to welcome you to our online program with Robert Abernathy, who's the former CEO of Halyard Health, a company you may not have heard of till now. It's become a real important company for all of us. And being former CEO gives Robert a great advantage because he can speak freely in a way that I suspect you can't when you're actually running the company and concerned what the share prices are going to do and how what you say may affect that. So that's actually great for us. Before you worked at Halyard, you worked at Kimberly-Clark, no?
Correct.
So you got both the face mask side and the toilet paper side.
That's it.
Become way more important products than 3 months ago. Or at least I'm not saying they're more important, but people are talking about them now.
That's exactly right. When they're in short supply, suddenly they're interesting.
Yeah. So Robert, just to start off, what is Halyard? What does it do? I mean, how come none of us have heard of Halyard?
Yeah, I'll start off with that. I've worked for Kimberly-Clark my entire career, and Halyard Health is the old Kimberly-Clark Healthcare. And so Kimberly-Clark had a healthcare business along with its great consumer products like Kleenex and Huggies, Kotex, Depend, Cottonelle, Viva, all those products. Mm-hmm. And in 2014, Kimberly-Clark decided to spin that healthcare business off, form a new publicly traded company. And I went from Kimberly-Clark to become chairman and CEO of Halyard Health. Halyard Health is a full range of sterilization, infection prevention products, as well as medical devices. So it's a market leader, number one or number two market leading positions in things like face mask and sterilization wrap and surgical gowns, large position in hospital gloves, as well as a number of other products. If you go into a hospital operating room, all that blue fabric that you see, everything that's draping over, tables and the patient, and all the blue fabric in the gowns and the headwear and the footwear, that's all Halyard's product.
So does Halyard sell directly to hospitals, or there's a middle guy out there? Or how does your product get from the factory to the operating room?
Very interesting. So you're actually selling to hospitals or through to physicians' offices or dental offices, et cetera. But contracts are negotiated through large group purchasing organizations. So you'll negotiate a contract that might be with a medical organization like Emory Health or Kaiser Permanente or one of the big hospital groups. And then you'll get that contract for a specific product category, like surgical gowns or face mask. And then you'll sell directly through a distributor. In most cases, that distributor relationship would go through, of Halyard's products, would go through Owens & Minor or Cardinal Healthcare or Medline, one of those big distributor organizations, which then leads me to kind of the next step of Halyard's evolution. It started in 2014. In 2017, we decided to sell all of the sterilization products that I just talked about, all the blue fabric. Decided to sell that, and we sold it to Owens & Minor, one of our big distributor partners. Mm-hmm. So now when you see the Halyard product, either stenciled on the chest of a surgeon's gown or on other products, that's actually Owens & Minor's product now. So all those great brand names are now owned by Owens & Minor, one of the best distribution companies in America. So proud to sold that part. And then the remaining part, the medical devices, the respiratory care, the digestive health products, stayed with what was the old Halyard company.
And did Halyard and now Owens & Minor, they own the factories, or it's contract factories? Because it's super high standards that you have to meet, I'm hoping.
Exactly.
With sterile products that go into operating rooms.
For Halyard and now Owens & Minor, we owned our own factories. So at one time we had about 16 different factories. About 8 of those went to the Owens & Minor company as they purchased those product categories. Most of the factories are located along the border of Mexico. And then one big factory is located in Honduras. Then we have a manufacturing plant making the base material, that blue fabric that I talked about, that's in North Carolina. So that's the factory structure. People often ask me, why did Kimberly-Clark ever even get into the hospital business, into the medical products business? And you really have to go back to the late 70s when Kimberly-Clark was entering the diaper business. And to establish the products required for premium diapers, they developed unique nonwovens materials, which are made of polyethylene and polypropylene. And those materials go into the side cuffs of a diaper or along the waistline of the diaper to keep fluid from passing through.
Right.
And those unique materials that were used in diapers, somebody said, well, we can treat that material such that fluid doesn't pass through it, and we can then make surgical gowns, and we can make sterilization wrap. And so as a result of the development of the diaper business in Kimberly-Clark, we then got into the healthcare business. And then it became, a very important business, $1.7 billion in sales.
I never would have thought the diapers would lead to this. So we're all talking about face masks, right? And
exactly.
I can tell, we all think there's two kinds of face masks. The ones that you buy that come out of a little pop-out thing, you buy it at CVS.
Right.
And then there's, everybody's learned the famous R95, the super famous ones. I'm guessing there's way more face masks than that.
There are, but those are the two big categories that we really ought to talk about. So there's what you generally call surgical mask, and a surgical mask, something similar to this, that would have pleats in it, and then it's layered of material. It can either have sort of the ear hooks around it or tie in the back. Those are essentially a loose fitting garment that goes over the nose and mouth, and it's essentially a barrier protection. And then those can be labeled in different ways. They can be a dental mask, they can be an isolation mask, they can be a surgical mask, or they can be a general use mask. Like you just commented, Charles, they can be in different thicknesses, they can be in different protection levels, and different colors, lots of different things. So there's many, many different types of masks, but generally think of those as surgical masks. And those surgical masks are, as I said, a barrier protection to keep splashes or sprays off of the caregiver, and vice versa, to keep, anything that might breath from the caregiver into the patient, particularly when you're dressing a surgical wound or something like that. So that's one category, a big category of mask I'll call surgical mask. With all the controversy over mask, that is not the mask you're hearing about. So when people say we're short of mask, they mean the N95 mask.
N95, not R.
Now the N95 mask, that's usually a cone mask or a duckbill mask. And those masks are very specific in terms of how you make them to give a filtering capability. And it has to be able to filter very small particles, 0.3 microns. It has to be able to be sealed around the mouth and nose such that literally you're breathing through the mask. That mask is filtering. When you think of a loose fitting surgical mask, most of what you're breathing is coming through the sides.
Sure.
It's more, think of surgical mask as a barrier protection, splashes and the like. Think of a cone mask, an N95, literally as a filter media. You're filtering what you're breathing in and out. And the N95 mask is what's required for virus-sized particles. So because of that, people who are now caring for COVID-19 patients need the N95 mask, and that's the mask that's in critically short supply. So all the conversations about the state of New York needs more masks, or Detroit needs more masks, or caregivers are being told you can only get one mask per shift, and that's all we'll give you. We're talking about N95 mask. So that doesn't mean there's not also a shortage of the surgical mask. There are, but the ones you're hearing about mostly are the N95s.
And pre-COVID, how many N95 masks would a caregiver, a surgeon, I mean, would they even use it ordinarily, or they only use it under these very specific circumstances? And how many would a caregiver, a surgeon, a nurse use per day?
Well, you'd only use them, you would only use an N95 mask for an infectious disease person. So someone who has a virus disease that could be transmitted to you or to someone else. So because of that, the usage is very low. Typically, regular masks would be worn in most cases. And quite frankly, when you look at total masks that are used, many times a nurse or a caregiver would go an entire shift and not use a single mask. So if they're going in, taking vital signs, giving medications in a hospital surgical med-surg wing, probably don't use the mask for an entire shift. If they're going into to do something specific, that dressing a wound or something like that, where you want to make sure that you didn't contaminate that wound site, yes, you'd probably wear a surgical mask. But only if you were in a situation where you knew it was an infectious disease state, including virucidal particles, then you'd want an N95 mask. So those are pretty rare. But when you have these pandemics that spike up, like H1N1 or SARS, of course now COVID-19, then the demand for those goes up, at a spike level. And what has aggravated it even worse this time is you don't know which patients have it and which don't.
Sure.
Because the COVID-19 is overlapping with a regular flu season. And so you don't know. And the test is taking days to get back the results. So someone's in the hospital and you still need to have those N95 masks to be able to care for that patient. Now, to complicate it even further, all these products are single-use products. But unfortunately, due to the shortage of them, caregivers are holding on to their mask and they're using them multiple times or even multiple days. So it's compounding the problem in terms of folks thinking, I'm just not getting the protective equipment that I need.
And with an infectious disease, a super infectious disease like COVID, if there were enough supply, how many would a nurse or a physician use per day, use per shift?
Well, let's say you're treating, let's say you've got 12 patients that you're caring for. You'd put on a different mask every time you went in and out of that room.
Okay,
so you might
talking
go
a lot.
You might go through dozens in your shift, and then the next person would go through dozens on their shift. And then, so you can see how that would be. I mean, literally, the procedures when you're in an infectious situation, there's very specific procedures about how you gown up, how you don the mask, the gloves, and then when you leave, how you take all of that protective equipment off so that you don't contaminate yourself. And then that equipment goes immediately into a bin to be disposed of. So there's very specific procedures of how you put on protective equipment, how you take it off in highly contagious situations like COVID-19. So ideally, you'd have new masks, new protective equipment each time you had that patient interaction.
Okay. Wow. So you go from using very few per day to using dozens a day, perhaps.
Exactly.
Shift. Okay. So that explains the spike. How come you can't just, okay, we'll go from a shift a day to 3 shifts a day at the factories. How come you can't just turn up the knob and crank these suckers out?
Well, let me first explain how we got into the problem. Then let me explain how we might get out of the problem. So the problem, let's stay with mask, N95 mask. The problem really goes back to 2019. And in 2019, the world supply of masks was low because of the Australian fires.
Okay.
The masks were being consumed at a huge level because of the smoke. You needed to filter the smoke particles in order for the firefighters not to get, overcome. So there was a huge demand that was absorbed by the Australian fires, as well as by the public, because you saw the pictures of the cities
Sure.
in Australia and the smoke that overcame the cities. So there was a desperately low inventory level coming into
Okay.
the new year. Then you layer on top of that the Chinese New Year, which shut down factories, and half of all the masks are made in China. So you factor in that shutdown on top, and then something that really caused the problem, which was the first week in January, China bought over 50,000 N19 masks from other parts of the world, and then bought over 20,000, million, 20 million, 50 million at the first week of January, another 20 million the last week. They purchased 1 month's world supply.
Wow.
They purchased 1 month's world supply. Then layer another event on there. They then said, we're not going to ship masks, either surgical or N95, to anyone else in the world. And they held that export restriction for another month. So we went from a low worldwide inventory level anyway because of Australian fires to 1 month's world inventory level, 1 month's world supply went with these purchases, and then another month of half the world's supply being China manufactured being restricted from export. Also, there was kind of a little bit of additional problem, and that is because it hit China first, suddenly big companies started donating to them. So 1 million masks came from 3M, and 500,000 masks came from Honeywell, and Bristol-Myers Squibb donated the equivalent of another 250,000 masks. So because they were the first and everybody wanted to rush to help,
Sure.
suddenly the largest producer in the world wasn't exporting, and a lot of masks from other parts of the world had gone into China and then weren't available to the rest of the world. So that's how we got into the problem. Now, how are we getting out of the problem? Two things. China is ramping up production in every area. The big N95 producers, particularly 3M and Honeywell, they're the two largest, they're ramping up production. So 3M, as an example, has roughly doubled their production. So to your question, literally, they had years ago installed extra machines just based on pandemics like this happening.
Yeah, okay.
And they did. They staffed up quickly. They have a plant in South Dakota, another plant in Nebraska, staffed up rapidly, started making more masks immediately. Honeywell, they've got a plant in Phoenix. They've got another plant in Rhode Island. Same thing, added 500 more employees, started ramping up production. So literally, we've just about doubled the amount of N95 products that are being required. Likewise, China has doubled their capacity and is continuing to invest. And interestingly enough, China's capacity in the regular mask, the surgical mask, has increased by 20-fold.
Wow.
They went from 10 million a day to 200 million a day, with plans now to go to 500 million a day. All with the idea that the consumers want these masks. So it's not just hospitals, it's not just dental offices. Now this idea that individuals want the mask, whether it's for pollution or for, medical crisis like COVID, but the ramp up is dramatic in terms of the production in China. On the surgical mask side, as an example, they were half the world's production. They will be 95% of the world's production within a year or two, if all these projections happen. So COVID has created this massive shift in terms of production. Now, China's now stopped their ban on exports, and other companies, other countries are now starting to get supplies out of out of China again. So we're starting to see relief already. In the latest kind of, to and fro between the administration and 3M, there was a negotiation to get 166 million masks of the N95 mask out of China to come to the United States. So that's going to make a huge impact in terms of the total availability of masks that can be distributed, not just in New York and California and Detroit and New Orleans, but as more and more states and large metropolitan areas need them.
Wow. Okay, I'm going to pause here for a second and ask people, if you got questions, please use the chat function on Zoom to send your questions to Fernanda Lucchina, and then she's going to send them to me, because we're getting close to the point where I'm running out of my questions and need yours. I'm
going to add one more thing on,
sure,
on the ramp up of production. So the biggest problem in ramping up production right now is the availability of the cloth-like material, the non-wovens material, which is called melt blown. So the availability of melt blown is now really the limiting factor to making more masks. And it's sold out. Melt blown prior to COVID was selling for $6,000 a ton. It's now selling for $60,000 a ton.
Oh, wow.
So it's sold out.
Who makes it? Where is it made?
Well, a lot of it's made, well, Kimberly-Clark was one of the largest producers of melt blown. There's a lot of melt blown producers. Most of the machines are made in Germany by Rykafil. A lot of Rykafil machines in China, in Korea, in South Korea. So there's machines, a lot of machines around, but they're at full capacity. Now in China, companies are starting to add machines, and in many cases they're building them themselves rather than sourcing them. A machine would usually take about 6 months to order, get delivered, get installed. There's some Chinese companies that have reported making and starting up machines in 1 month's time. So the availability of this base material melt blown is really the next limiter in terms of how fast you can ramp up that production.
So if you had to guess, I mean, where do you reach the point? How long does it take to reach the point where you get equilibrium between supply and demand?
I think it depends on your best case, worst case scenarios. If the worst case scenario for COVID-19 happened in the US and in other major places in the world, like Japan, like Brazil, you don't catch up until we have a treatment or a vaccination. You're always going to be chasing it. If a best case scenario happens, you probably catch up in a matter of months. Mm-hmm. So it's just a matter of those scenarios. Some articles say that, under the worst case scenario, even with a doubling, a tripling of the N95 mass production, that you're still probably only going to have 5 to 10% of the mass that you would need in a perfect situation.
Gee. Okay, so a question. If your child were a healthcare provider,
yes,
how would you feel? I mean, going in without the right personal protective equipment.
Well, the same way, every
Yeah.
healthcare provider feels you'd be nervous, you'd be anxious, you'd be mad. Even if you understood the facts, you'd go, yeah, I understand it, but what could have been done? And even if you say, well, governments can stockpile. No one anticipated stockpiles this big. I mean, the government had a stockpile. Singapore government's got a stockpile. So governments have stockpiles, but no one anticipated sort of the level of need that this has turned out to represent.
Wow. Okay, here's a question from Fernanda. Do you think this crisis will make the world as a whole, or countries in particular, rethink the supply chain? Do we need to stockpile more? Do we need to have more medical equipment and personal protective equipment either stockpiled or not being made in China alone, a more diverse production perspective?
I'll start with should we stockpile more? And the answer there is we should have a stockpile, but you don't want massive warehouses full of things that you might not use for 10 years, because there is an expiration date on them. And the expiration date isn't because of the cone mask itself. It's typically because of the elastic that attaches, that,
deteriorates.
Changing conditions, it deteriorates like a rubber band would, or other elastic material. I think what it'll cause us to think about is, like 3M did at its Nebraska plant, how can you have installed capacity such that within a month or so, you could ramp up quickly? You could hire people, have them trained, ramp up rapidly to manufacture the equipment. So I think there's going to be more thought on that. I think there's going to be more thought on commonality of products. As an example, the approvals for face masks, both surgical masks and N95 masks, are different in the US than they are in other parts of the world. And so many of the masks made in China that were called KN95 weren't approved for use here.
Oh, wow.
So the N95 masks are approved by the National Institute of Occupational Safety and Health, NIOSH, which is a division of the CDC, and other masks are approved by the FDA, but the KN95 masks weren't approved. Now they have been. So things like that, where you have more common approvals across the globe, where you don't get into that, we can only use this product from this country, et cetera, et cetera. So I think that'll also be part of changes that would be made longer term.
I believe that's called harmonizing the regulations.
Exactly. And the next area, of that question is, is it a worry that it's made predominantly in one place? Of course it is. You always want, to be diversified. I don't think we're going to have much choice in terms of certain products. There are going to be manufactured in certain locations. And China's clearly going to be one of those that dominates some product categories. Over time, you would hope that other countries, India, Vietnam, Cambodia, Mexico, would continue to be a major player, that you'd have enough diversity of product manufacturing that it wouldn't be so isolated. So I do worry about face masks with this rapid escalation of face mask production in China. When it was 50-50, you had face masks being manufactured in probably 20 or 30 countries around the world. That was less risk. But when it starts to be much higher than that, there are some risks associated with it. I will say, though, I don't think there will come a time where those particular product categories will come back into the United States. The margins on medical supplies are very low. You have to be in a low labor rate manufacturing location like Mexico and Honduras with Halyard, the now Owens and Minor products. I think that's just the state of manufacturing those types of products and garments. And it will be that, I think forever.
Let me ask you a question, and I've gotten this several different ways, about export controls, which are so appealing, right? The country, U.S. or whatever country you're talking about, China puts a ban on exporting, in this case, the R95 face mask. Yesterday, we talked with a woman who works at CARE who's real concerned about developing countries who don't have access to PPE because the wealthy countries bought it all up, right?
Right.
What do you do if you're Bangladesh or Jamaica or you name it? And it sounds to me like our R95s, if I understand you correctly, they're not being made in the U.S. They're actually being made right across the border in Mexico. So,
so many of the masks are made across the border in Mexico. The Halyard masks are, but most of those N95s made by Honeywell and by
they're made in the U.S.
They're made in the U.S. or in China, so they do have China plants as well. Back to your first part of your question. I'm a free trade guy. I typically don't want trade barriers. I understand them. I understand some of the rhetoric this time because first China said we won't export. Then South Korea, who makes these products, said they wouldn't export. Then Taiwan, who makes some of these products, said they wouldn't. Then when the crisis shifted to Europe, Italy, then Germany, then the Czech Republic all said, nope, we're keeping our own product that we made. We're not exporting. Most recently, France just put in restrictions against shipping any of their medical protective equipment outside of France. They just reneged on a big contract with the UK.
Wow.
So you hear these, so it's logical. You get to the US and somebody says, well, let's just keep what we've got. So, but then you back up and you say, no, that's not the right approach, because in many cases, that important melt blown fabric that you need, that's got to come from another country, and then other parts of what you're manufacturing. So it's rare that all your raw materials come from one country so that you can actually control it that tightly. But like I say, I prefer not to have that sort of restriction. Now let's talk about the developing markets. I mean, that is a huge concern because the price of the materials have gone up. So unless you had existing contracts in place that can be honored, and some countries do, they would have already been sourcing, face masks, protective equipment, for disease, treatments like Ebola or other diseases, or they were getting those for state-run hospital or government-run hospitals. But to now try to source as it spikes up with huge cost increases, it's very difficult. Very difficult.
What has? I mean, you were saying that the material, I can't remember the name you used. That
melt blown. Yep.
Melt blown. That it's increased 600%. Has the cost of an N95 increased 600% more than?
You've got basic materials that go into it. So if your materials go up, that may represent 30 to 40% of your production. Then your labor cost and depreciation and other things all play in. So as those materials go up, yes, the price of the finished good goes up. Typical face mask, a surgical mask would sell for anywhere from 6 cents to 10 cents a mask, and an N95 mask would sell for anywhere from 80 cents to about $1.20. Mm-hmm. So yeah, those could go up. I mean, an 80-cent mask could go up to over $1. And I'm not talking about black market where these things went up tenfold. I'm talking about, contracted with, reputable suppliers like 3M and going through normal distribution like Cardinal and Owens and Minor, then then there'll be some cost increase based on raw material, but it's not going to double or triple the price of the product.
There are a couple of questions here from various people about reusing the mask. Can they be sterilized? Can you put it in your microwave? Can you put it in your sterilizer? I mean, what, if you have to, you've got these bottlenecks in supply chain,
Mm-hmm.
Can you reuse these at all, or does that not work?
They're not supposed to, but in this case, there are actually some tests going on now where hospitals are trying to set up a protocol to sterilize the N95 mask.
Mm-hmm.
So it is possible, assume the mask hadn't been soiled or damaged in some way, if it's been cut, or if it's got, blood or, other materials on it, you wouldn't. But if it's been worn by a caregiver, it could be theoretically sterilized. Now there then have to be, some lightening of rules around, your sterilization procedures in hospitals, things like that. But yeah, there are actually some hospitals and some companies who are testing that to see if that might be a way to, in the short term, to bridge the gap.
I've got a question here from Lori, who says from Jacques, has a client with 1 million N95 masks ready to ship within 2 weeks. What's the disconnect? I mean, how can, people are producing more. How do we get them faster to the places where they need to be and get them to the care providers?
Well, a lot of that is shifting supply chains. So you say, where were these masks used? And they were used across a lot of industries. Construction industry, particularly painting. If you're painting, you'd wear an N95 mask. Mining industry, pharmaceutical industry, all these industries used N95 masks. Oh, and they were a major user of N95 masks.
And the industrial use is sterile. It could be, are they interchangeable with?
They are now. They've relaxed the rules because they are essentially the same. They have the same filtering capability. They've relaxed the rules. There is a memorandum of understanding between NIOSH and the FDA, and they've now allowed the products that were approved for industrial settings to come into hospital settings. Then you've got to make sure, how does it get to a hospital? So the distribution channels, the people who distribute into the mining industry and distribute into the construction industry are not the people that distribute into the healthcare industry. So you have to get the right distribution set up to get those into the healthcare system. So I expect that'll happen quickly. And we've had many examples like that because all of a sudden all these masks started showing up.
Right.
Mark Zuckerberg, he's got 750,000 masks, and then Bill Gates is getting masks, and all these people are getting masks. You go, well, what were these masks for? And a lot of them had been purchased by companies based on having masks available for their employees because of the California fires. And so they had them in warehouses. And so suddenly there's lots of masks available. So the president's task force, 3 weeks ago was asking everyone that had these stockpiles of masks to please get them to the medical community, and it worked. Suddenly, folks said, "Yeah, we've got some. Oh, we've got 500,000 here. We've got 30,000 over here," and it worked. They started saying, "Yep, now we understand what to do. Let's don't stockpile them in case there's the next round of California wildfires.
Right.
Let's get them to the right people."
Yeah, let me just point out for the record that in California, companies over a certain size are required by the California version of OSHA to have masks on hand just for that, for wildfire.
Exactly. Yep. Good point. Thank you, Charles.
Okay. If you were still the CEO of Halyard, would you stop providing masks to the mining industry and agriculture and
No.
using spray paints? Do you stop doing that while you've got a health crisis going on?
No, but I'd be very aware of the rapidly dropping demand. So with people staying at home and many industries, constructions, certainly declining rapidly. So, I'd change my model to make sure I had adjusted for proper inventory levels for those industries so that I could get more and more products into the health community. But the last thing you want are people out there with, toxic materials that they have to deal with at a chemical plant or wherever, to be out there without their protective equipment. They might be in the greatest danger of all. So you have to think through, but clearly there's less activities like that going on with people, being asked to stay home.
Okay, well, we've got a wealth of questions here. I'm gonna try to work through them. Amanda asks, in January, when you saw these huge purchases by China, is there some sort of reporting system? Do people then, call up CDC or call up Department of Health or call up, you tell me, and say, holy cow, China's clearing the market, something's going on?
There have been some good articles written about 3M, that their planning and logistics people may have been the first to recognize this. And they saw what was happening in terms of this sudden dramatic change in the inventory levels, which they track, daily basis, as you could appreciate, and then suddenly saw these purchases. So I think well before the public in the US knew that there was a crisis in China, obviously there was a crisis. The government was buying up the first week in January, and I think some very bright, logistics and planning people at companies like 3M were early to see it.
It's a leading indicator.
Yes, absolutely. When
Sure.
when a country buys, a full month's supply of the world's supply, you go, oh, something's going on here.
Yeah, no kidding. There's so much concern ordinarily about, you name it, products that are counterfeited. Are there counterfeit N95 masks out there that are being sold that really don't do the job?
Well, there most likely are. Whenever there's, a money-making opportunity, there's a scammer out there somewhere to take advantage of it. You do have to be careful. There are a lot of cone masks out there that are not N95. So this idea of, if it's a cone mask, it's N95. So you could have, 6 months ago, gone to CVS and bought a cone mask that talks about removing 99% of particles, but it doesn't seal, it's not marked N95. So to be an N95 mask, it'll be stamped, stenciled on N95. So, but there are some people now that are probably counterfeiting those types of masks, but it's going to be a rare occasion.
Okay, switch a little bit to the surgical masks, the face masks.
Yep.
You're now seeing everything from all over the internet, people instructions how to sew your own. You've got all kinds of stuff going on with companies that are shifting to make those. Interestingly enough, this woman from CARE yesterday said that in Cox's Bazar, Bangladesh, in a refugee camp, they've got sewing machines set up, and they're producing face masks. Does that, obviously that doesn't help with the N95, with the R95, but does that help?
It does. There's been this whole controversy about, should individuals wear masks or not? And the big concern has been if you suddenly told the general public in a large country like the US that everyone needs to wear a surgical mask, well, then we wouldn't have enough surgical masks for hospitals. But the idea of just covering your nose and mouth, such that, if you sneeze or you cough, or someone else sneezes or cough, it's primarily captured in whatever's covering, whether it's just a cloth material or whether it's a mask material, so that 6 feet of separation now becomes much safer. Um, so there's certainly relevancy to just covering your nose and mouth in order to maintain that separation from other people. There are a lot of startup companies. There's now 2,500 companies in China alone making face masks. Mm-hmm. And it's relatively easy to make a face mask if you can get the materials. And the materials are the problem. There's a lot of homemade face masks that are going to be made with, cut up parts of surgical gowns or the sterilization wrap that you use in a hospital because it's actually sterilized and clean. It's never used in a medical situation. So there are people cutting and sewing those and to make just a facial covering, and they will help, but they're not going to be the right product for a hospital.
Okay, let me go to the topic that we advertised this program. Where in the world is all the toilet paper? Presumably, the national consumption of toilet paper has not increased. We're all using the same amount per day we used before. Is it just an issue of hoarding? I mean, what's going on?
No, what really happens there is that there's a substantial portion of the toilet paper that goes into the consumer business. It goes into your grocery store and mass merchandise, Walmart, Target, et cetera. But then there's a big component that is the away from home market. It goes into restaurants, it goes into hotels, it goes into airports, it goes into stadiums, and suddenly that's just gone to zero. In fact, there's a restaurant near Lenox Square in Atlanta that said free roll of toilet paper with each takeout order. This is bandannas.
Yeah.
And that's because they had cases of toilet paper in the back room because they were counting on their regular business continuing. So the problem with toilet paper is getting that whole distribution channel into the away from home market and getting it all into the consumer market. And it's not that simple. You have to convert your manufacturing equipment such that you're packaging it in the right package. It has the right barcodes on it. It goes through consumer distribution. So that was one part. The second part was when suddenly everyone was shopping at one time, stores couldn't replenish the shelves fast enough. There was toilet paper available in warehouses. There was toilet paper even in the back room of the grocery store. They just couldn't get it to the shelves. Mm-hmm. They didn't have the manpower on that sort of first mad Friday and Saturday rush. And since then, what's happened is then it created, kind of the run on the bank syndrome. Everybody said, well, I got to go get some. So now the in-home inventories are huge. Now, people, I think you said it right. The actual consumption hadn't changed, although it might have gone down a little bit. There was something floating on the internet the other day of an individual said, yeah, I used to spin that toilet roll like it was Wheel of Fortune. Now I spin it like I'm cracking a safe. So I think people might actually be using a little bit less. But in general, it's that shift from the away from home market into the consumer market, and that'll catch up quickly.
So, I mean, so it'll just catch up. I mean, it'll be there. We're patient enough and we've got enough.
Well, I think it's already starting to show up. You can now, you might have to search a bit, but you can now find toilet paper in Walmart. You can find toilet paper in Target in most cases. But it might not be the exact brand you want. If you used to buy Cottonelle, you might now be buying the Kroger brand. If you used to buy, Sherman, you might now be buying Northern. But there's inventory that's starting to show up, and groceries, they're adding more people. That's one of the areas where there actually is job employment opportunities because they just need more people to stock the shelves.
Oh, I can imagine. Okay, well, I feel better about the toilet paper. I still feel kind of bad about the about the face masks.
Yep.
And I'm particularly concerned about people reusing those masks.
Well,
is there any data about the safety of reusing masks?
Well, there's there's no data that you can put your hand on now, but we do know one of the largest problems in hospitals, even before the pandemic, was infections.
Mm-hmm.
So infections were already a priority in hospital and in terms of how to reduce the infections of people who came in with one problem and then end up getting an infection, sometimes a staph infection, while they were at the hospital. So there'll continue to be a problem with infections, and so therefore having the proper equipment, PPE, is essential. And the more you're reusing equipment, PPE, the more likely you are to transfer, a disease to yourself, an infection to yourself or to another patient.
Okay, I think I've exhausted the questions. There are a couple of them I skipped, but I gotta go back and find them, and I don't want to spend the time doing that. Robert, I want to thank you. This has just been terrific. I got to tell you, starting from a low base, but I sure feel an awful lot smarter.
Good.
And I appreciate it. This has been really, really helpful. So on behalf of the World Affairs Council, I want to thank you for this. I should have said when I introduced you at the beginning, it's one of our board members, and I appreciate you as a board member, and I appreciate the board members who've been willing to come on and do programming with us. So thank you very much.
Thank you, Charles. I've enjoyed it as well. So
everybody who's watching, I hope your wife is watching.
Yes, she's right here on the couch.
Okay, good, and the cat. Everybody else, I want to thank you for spending an hour with us. It's been great for us. Tune in again. Next Wednesday, we have John Hope Bryant, who is the founder and CEO of Operation Hope, which works with and does financial literacy for the people who are the most economically vulnerable. And he's going to talk about what's happening to that community now. So we have these huge layoffs. And as Mark Becker said, we've got a 100-year pandemic, and we've got a 100-year economic recession at the same time. And so that's really difficult for everyone. Next, I want to say it's Friday, we've got Signe Schneider talking about corporate social responsibility in the time of COVID. We've got a whole bunch of speakers lined up. Please check our website. We're adding them on now and putting up the registration links. We've got great stuff. We're already programming well into May. So thank you all. I also want to thank the UPS Foundation, which has helped support this series talking about COVID and our reaction to it. So thank you, UPS Foundation. And Robert, thank you so much. Again,
thank you, Charles.
One more person is Ladarian Gillette, who is the producer of this. She's on our staff, and she's done a great job making sure all this works real well. So thank you all, and I hope to see you all next Wednesday.
Thanks, everyone.